Hi there, everybody. My name is Matt Perry. I'm the CEO here at Genesis, and today I have the pleasure of introducing Tawnya Willey. Tawnya is a registered nurse. She is the infection prevention consultant here at Genesis. We're able to talk like this without our masks on because you have this nice plexiglass in between us. It's a nice big barrier. Well, Tawnya, tell us about what you do every day. What do you do at Genesis?
I do a lot of things to help to basically prevent infection. So
Okay.
contagious diseases, I do a lot of things to prevent exposures and transmission, and then I monitor those events when they do happen.
Okay.
So something called contact tracing is what I perform.
Yep, you know about that, right?
Yep.
Yeah.
So with every positive employee, I do it. With every patient that's positive that maybe we didn't recognize right away,
Yeah.
I do it with those, and I look at the encounters to see if everyone was wearing protective gear and if that exposure was low risk or not.
So you are in the thick of it, right?
Mm-hmm.
And you do all the research about what works and what doesn't, and you track whether it's working. So so since you've been in the thick of it for 18 months, what have you found that that prevents us giving it to ourselves or each other or patients, while we're here at work together?
Overwhelmingly, being prepared for anything every time with a surgical mask or just wearing a mask at all times. That's been the biggest way to prevent.
Very good. So have we had any? So we've been wearing masks for 18 months. Have we had any that you're aware of? Have we had any cases of people within Genesis giving it to each other or to a patient if they've been wearing their masks properly?
No, that's not happening at all.
That's a remarkable accomplishment when we know that we have the sickest of patients with COVID and we've got 4,000 people clustered together working together.
Right.
That's amazing. So why does a mask work? How does a mask work?
Well, it's a basic concept. If you think about, it's barrier. So,
Okay.
it doesn't have to be thick necessarily, but dense.
Okay.
These specifically will protect you each way from getting it or giving it. But the basic concept is when you talk or sneeze or cough, droplets come out. You
Okay.
can't see them.
Okay.
Some are big, some are small.
Okay.
COVID droplets can be tiny and they can sometimes get through this,
Okay.
but for the most part, most of those droplets are maybe going to stick together and they're not going to come through.
Good.
If they do and they get to you because you're within 6 feet of me, it still has another barrier to go through.
If I'm wearing my mask.
Right.
Got it.
So,
Okay.
yeah, it's got a long way to go before it can get into your nose or your mouth and cause an infection.
So it's really that simple.
Mm-hmm.
Amazing.
You just put up some barriers to kind of
Okay.
slow it down.
Very good. Very good. So obviously we have some of our staff who are sick out with COVID. And if you've not seen it getting it here when people are masking appropriately, how are our staff getting it?
Well, and you never can know 100% where they get it, but my investigation kind of stops at our exit
Right.
from the organization. But these individuals are relaying back to us that they're on vacation or they have a household member, maybe it's a school-age child or
Okay.
a spouse that is positive, and they always seem to have another risk factor present.
Got it.
And don't report concerns that they picked it up here
Got it.
generally. So.
Got it. Very good. So we sum it all up. What's your recommendation?
I would recommend that it's a great tool to use. It's not forever.
Yeah.
Use your best judgment. You've looked at research, I'm sure, and all this time, and you've come up with your own ideas and opinions, and so just kind of wear it when the transmission is high, when you're going to be in crowded areas, when you
Okay.
have to be close to people and you can't separate. It's a preventative tool, and combine that with hand hygiene. And just don't touch your face. Keep your mask clean.
So whether it's a healthcare organization where people are packed tightly together, or a school, or another area the place where you're a church when you're really packed tight together, if you're wearing masks, it's going to prevent the spread.
It is very likely
Very
it will
likely
prevent
to
it.
do that. Very good. Tawnya, thank you so much for sharing all of your experience with us. this is what you've heard is what we have learned over 18 months of what works and what doesn't right here in Zanesville. Okay, and we have literally thousands of people inside Genesis, our staff, thousands of Genesis staff, taking care of thousands of COVID patients all day long, 24/7, and we've been able to do that safely. And I know that that if we do the same basic protocols based upon our experience here in schools and churches and other crowded areas, then we're going to prevent this spread from happening, and we're going to kill off this thing. And so I know if we can do it, the rest of the community can do it. And the good thing is it won't be forever. And we really appreciate any help that you all have. And thank you so much for watching.